The clipboard felt heavier than usual against Megan's chest as she pushed through the pediatric ward doors at Mercy General. 7:30 in the morning, Portland still dark outside the hospital windows, the fluorescent lights casting that particular shade of institutional white that made everything, skin, walls, hope, look faintly jaundiced. She kept her head down. That was the strategy. Clipboard. Soft shoes. Eyes on the monitors, not on faces. The other nurses had learned not to invite her to break room lunches sometime around week 3. She'd stopped trying to sit with them by week 5. The hallway smelled like antiseptic and something underneath it, something metallic and wrong. She'd learned to recognize that smell in places she couldn't talk about. It was the smell of bodies running out of time. Room for 12 was at the far end of the corridor. Megan's pace didn't change, never changed, always measured, always steady, but something in her breathing shifted as she approached. 8-year-old Lily Caldwell. 3 months in the hospital. 3 months of watching the child's weight collapse like a building with the foundation removed. 68 pounds on admission. 58 6 weeks ago. 51 as of this morning's weigh-in. The numbers didn't make sense. Megan had seen them. Seen every single one of the 20 different doctors' test results taped into the chart. Blood work normal. Metabolic panel normal. Imaging normal. Endoscopy normal. Rheumatology workup normal. Infectious disease panel negative. Oncology panel negative. Neurology negative. Gastroenterology negative. 13 more specialists, each one certain the answer wasn't in their department, each one signing off and moving on, leaving behind a child who was disappearing in plain sight. 20 doctors. All brilliant. All confident. All wrong. Captain James Caldwell stood beside his daughter's bed, and Megan could see it in the set of his shoulders, the kind of helplessness that came from a man trained to solve problems with precision and force, suddenly facing something that wouldn't respond to either. He was tall, still lean from whatever deployment had taken him away long enough that his sister Rachel had been sleeping in the hospital chair beside Lily's crib when Megan started her shift 2 months ago. Army Ranger, that kind of bearing. The kind that didn't break easily, which made it worse when it started to crack. Lily was awake. Small. Too small. Her arms looked like she might snap them by moving too fast, and she lay perfectly still, as if understanding at some cellular level that movement cost calories she couldn't afford to lose. Her dark eyes tracked Megan as the nurse moved into the room, and Megan caught something there, not fear, not exactly. Recognition, maybe. The look of a child who'd already figured out that the adults had stopped knowing what to do. Morning rounds are in 20 minutes, Rachel said from the chair. She had Caldwell's sharp eyes, but softer. Exhausted. The kind of exhaustion that came from sleeping in chairs and drinking coffee from the cafeteria that tasted like it had been made sometime during the previous administration. Is Dr. Hargrove going to have answers today? Megan moved to the full line without answering. The question didn't require an answer. They all knew he wouldn't. She pressed 2 fingers against the skin below Lily's elbow, checking the site. Clean. Patent. She'd inserted it herself 4 days ago, a 22-gauge peripheral line in the left antecubital fossa, and she'd been the only one checking it properly since. The adhesive was starting to curl at the edges. She made a mental note to replace it before the afternoon shift. He said the biopsy results came back, Captain Caldwell said. The flatness in his voice was the sound of a man who'd stopped believing in good news. But he wanted to review them with the whole family during rounds. All of us here. Formal presentation. The biopsy had been gastric mucosa taken during the endoscopy. Megan had reviewed the preliminary pathology report in the chart system this morning when she couldn't sleep, which was most mornings, if she was being honest. Normal. Completely normal. No celiac disease, no inflammatory markers, no dysplasia, no dysbiosis, nothing. Just a healthy child's tissue slowly starving to death for reasons that apparently existed in some dimension the medical establishment hadn't learned to access yet. She checked Lily's temperature sensor. 98.6, check the pulse ox reading on her finger. 94% on room air. Respiratory rate 12. All the numbers looked like a child at rest, like a child sleeping, like a child who wasn't in the process of becoming a ghost. But the jugular veins. That was what made Megan pause as she tucked the blanket back around Lily's small frame. The jugular veins were distended. Not dramatically. Not the kind of thing that would make a doctor stop mid-round and order an emergency workup. But there. Subtle. The kind of detail that got missed when you were looking at test results instead of looking at the child herself. Megan's eyes traced the pattern, and something in her body went very still. The kind of still that came from recognizing a problem from somewhere deep in memory, a place she didn't let herself visit often. "I'm going to get fresh water," she said. Her voice came out soft, careful, professional. "Can I bring you anything, Captain?" He shook his head. Rachel mouthed thank you without sound, and Megan was already moving toward the door when the noise started down the hallway. Footsteps. Multiple sets. Expensive leather shoes striking tile in a rhythm that sounded like a heartbeat about to flatline. Dr. Hargrove's rounds were starting early. The team was gathering. The entourage of residents and fellows who followed him like remoras on a shark, each one frantically taking notes, each one certain that the secret to being brilliant lay in agreement rather than observation. Megan moved to the side. Clipboard pressed against her chest like a shield. She'd learned to make herself small in these moments, to take up no space, to be the kind of presence people walked past without registering. It was a skill she'd developed in a different life, in different uniforms, in places where being noticed was the fastest way to become a complication for command. But as Dr. Hargrove swept past her into the room, his white coat crisp as surgical gloves, his presence moving through the doorway like something that displaced air pressure, she caught the smell of expensive cologne mixing with antiseptic, and she felt something settle in her jaw. The kind of thing that happened when you recognized a problem that wasn't going to solve itself. 20 doctors had missed something. 20 different minds, each one confident in their expertise, each one certain the answer wasn't theirs to find. That took a particular kind of certainty. That took the kind of confidence that came from never being wrong, never being questioned, never having to listen to anyone who might suggest they'd missed something obvious. Hargrove was already pulling up Lily's chart on the workstation, his fingers moving across the keyboard with the brisk efficiency of a man who'd learned to make decisions without doubt. The residents clustered behind him like ducklings. One of them, a woman no more than 28, probably, with fresh notes on her badge, glanced at Megan standing silent beside the door and then away, as if Megan was part of the equipment. "All right," Hargrove announced, his voice carrying the particular timbre of someone who was about to deliver wisdom. "Let's discuss what we're not seeing here." Megan's hands went very still. Her breathing evened out. She'd heard that phrase before, too. In a field hospital. In a tent that smelled like diesel fuel and blood. From a surgeon who'd been about to let a child's mother die because the obvious answer wasn't the correct one. The difference was, that surgeon had listened when she'd spoken. That surgeon had been trainable. That surgeon had understood that hierarchy and competence weren't always the same thing. Megan was not confident that Dr. Hargrove held that same capacity for growth. But that wasn't the worst part. The worst part was that she had to stand there, clipboard pressed against her chest like a burden she'd already learned to carry, and watch while a child continued to fade. Because if she spoke up, if she suggested what her body already knew with the kind of certainty that came from experience she couldn't cite without questions she couldn't answer, she would become the problem instead of the solution. She would become insubordinate. She would undermine physician confidence. She would create a hostile environment. She would be exactly what the other nurses had decided she was, just a nurse in the way of real medicine. The monitors beeped their steady rhythm. The fluorescent lights hummed their mechanical song. And in room for 12 at Mercy General, in Portland, in a city she'd chosen specifically because no one there knew who she used to be, Megan O'Brien clutched her clipboard and watched a room full of certainty miss something that was becoming less obvious by the hour. Her hands were steady. Her face was calm. Her composure was perfect. But underneath the skin, underneath the soft scrubs and the deferential stance, something older and harder was beginning to wake up. Something that had been trained for exactly these kinds of moments when staying quiet meant watching someone die, and speaking up meant becoming a problem. The choice, as always, was terrible. And it was hers to make. The choice, as always, was terrible. And it was hers to make. Dr. Hargrove arrived at Lily's bedside at 9:41 a.m. on Wednesday, his white coat trailing behind him like a cape, for residents shuffling in his wake with their tablets and their careful postures. Captain Caldwell stood on one side of the bed, his sister Rachel on the other, both of them looking at the doctor like he was holding the answer they'd been searching for. Megan stood at the foot of the mattress, clipboard held against her chest, and watched Hargrove perform the ritual of rounds, the physical exam that was more theatre than medicine, his hands moving with deliberate precision across Lily's abdomen while he narrated his findings to the residents as if the child and her desperate father weren't listening to every word. "Interesting presentation," Hargrove said, not looking at Lily but at the young doctor's scribbling notes. "Significant weight loss over a compressed timeline, but all imaging has been remarkably unrevealing. It's actually quite instructive. Sometimes the body presents with symptoms that have no organic basis. Psychological factors, stress-related manifestations, sometimes even parental anxiety masquerading as medical necessity." Megan's jaw tightened. She'd seen it before, in field hospitals outside Ramadi, doctors so certain of their own knowledge that they stopped looking when the obvious answers didn't materialize. "Doctor," Megan said quietly, stepping forward, her cardiac sounds have changed over the past 2 days. There's a subtle muffled quality to the S1 and S2 heart tones. Combined with the weight loss and the elevated respiratory rate, it's consistent with. Nurse O'Brien, Hargrove's voice cut through hers like a scalpel, "When you complete medical school, I'll be sure to ask your opinion." The residents smiled. One of them looked away, uncomfortable. Hargrove turned back to his assembled students as if she'd never spoken. "What we have here is a classic case of investigative bias. The more tests you order, the more you see what you're looking for. Sometimes the most difficult diagnosis is no diagnosis at all." Captain Caldwell's jaw clenched visibly. He said nothing, but his eyes moved to Megan's for just a second, a flash of recognition that she'd seen something no one else was seeing. Then he looked back at his daughter, whose ribs were becoming more prominent against her pale skin, whose collarbone had sharpened into something almost skeletal. The rounds ended. Hargrove and his entourage moved to the next room, and Megan was left standing at Lily's bedside while Rachel whispered to her brother that maybe they should get a second opinion, and Captain Caldwell said quietly that he'd make some calls. Megan documented her observations in the chart, notation of the cardiac findings, the respiratory pattern, the subtle clinical deterioration, knowing as she typed that Hargrove would likely dismiss it, but documenting it anyway because that's what you did when you were trying to be invisible and professional and absolutely certain that your instincts were wrong. But that wasn't the worst part. At 2:33 p.m., Hargrove made an announcement. He gathered Megan's department in the hallway outside Lily's room, not privately, not in a meeting room, but in the open corridor where Captain Caldwell was sitting in a vinyl chair nearby, where Rachel was coming out of the cafeteria with a coffee, where 2 other patient families were visible through open doorways. His voice was loud, measured, and deliberately public. "I want to address something that's been affecting patient confidence and the working environment," Hargrove said, his eyes landing on Megan like a targeting system. "Nurse O'Brien's constant questioning of my treatment protocols undermines patient care and creates a hostile environment for physicians to do their work. I need the medical staff to understand that second-guessing established treatment regimens is not collaborative. It's insubordination." The hallway felt smaller. Megan could hear the fluorescent lights humming overhead, that constant electrical vibration that never quite stopped, never quite let you forget you were in a building designed to save lives and sometimes, despite everything, to fail them. She said nothing. Her hands remained steady on her clipboard. Then Hargrove walked directly to the unit board, the whiteboard outside Lily's room where shift assignments and care plans were posted for the whole ward to see, and wrote in large, deliberate block letters, "N. the Brian, insubordination, hostile environment for physicians." He underlined it twice. Captain Caldwell's expression didn't change, but something shifted in his posture. He stood. For a moment, Megan thought he was going to say something, but then his sister put a hand on his arm, and he sat back down, his eyes never leaving the board. The rest of the morning passed in the strange suspended time that hospitals operated in, time that moved too slowly and too fast simultaneously, time measured in vital signs and medication schedules and the desperate hope that the next test would finally provide answers. Megan was reassigned to cover post-op recovery. She didn't argue. She packed her things in the break room and tried to ignore the weight of every eye that wasn't meeting hers. Lunch came at noon. She sat down at the break room table with a container of rice and vegetables, something simple, something she could eat without tasting, and watched as every single person in the room, Maria, Tom, Jennifer, the entire day's shift, grabbed whatever food they'd brought and stood up at nearly the same moment, as if choreographed by some invisible conductor. They left without a word. The silence they created was active, deliberate, a statement more powerful than any insult. The only sound was the hum of the fluorescent lights and the distant electronic beeping of monitors from the ward beyond the break room walls. She sat alone at a table meant for 12. Hargrove came in at 12:17 p.m. He poured coffee from the pot, the same pot Megan had made at 6 a.m., with an air of complete certainty in his place in the room, in this hospital, in this moment. He spoke loud enough for the stragglers in the hallway to hear, for the residents walking past with their cups, for anyone who might benefit from the lesson he was about to deliver. Some people, he said, his back to her, stirring his coffee with measured, deliberate movements, just aren't cut out for the complexity of real medicine. Perhaps our little clipboard nurse should consider a less demanding specialty. Nursing homes, maybe. Or phlebotomy. Something with fewer opportunities to undermine physician judgment. One of the residents laughed nervously. Another stepped away from the doorway. Megan took one measured breath. She set her fork down. She looked at her hands, hands that had held pressure on arterial bleeds in conditions where antiseptic was a luxury, hands that had performed emergency surgeries in field hospitals where the loudest sound was incoming fire, hands that had once delivered a tiny premature infant in a combat zone while the mother hemorrhaged and the nearest real hospital was 70 kilometers away. Hands that knew things her voice wasn't permitted to say. A single tear escaped her left eye. It was a physical response, involuntary as a reflex, and she wiped it away with the back of her hand without breaking eye contact with Hargrove. The room went completely silent. The fluorescent light seemed to hum louder. Megan stood. She walked to within 3 feet of him, close enough that he had to turn to face her, close enough that his eyes widened almost imperceptibly. Her voice came out low, steady, absolutely controlled. Not a request. Not a plea. A statement of fact delivered like an order. I've watched better men than you let children die because they were too proud to admit they missed something. Then she turned and walked out of the break room, past the doorway, past the residents who suddenly found their shoes very interesting, past the cooling pot of coffee and the stainless steel sink and the fluorescent lights that never stopped humming, never stopped bearing witness to the small everyday violences that hospitals contained. Hargrove stood frozen, his coffee cup halfway to his mouth, his face flushing red as the residents stared at their phones and the hallway filled with the kind of silence that meant everyone had heard exactly what had just been said and no one was going to admit it. He opened his mouth. He closed it. He sat down at the break room table, the table where he'd just dismissed her entire career, where he'd tried to make her smaller, quieter, less dangerous to his certainty, and said nothing at all. Megan walked to her locker on the 4th floor and began moving her personal items into a bag. A photograph of a unit she'd served with. A pair of reading glasses. A small first aid kit she'd assembled herself years ago. The things a person collected when they were trying to build a life that didn't require anyone to ask questions about their past. She wasn't crying anymore. The tear had been her body's last negotiation with normal emotion. Now there was only the cold clarity that came from understanding you'd just crossed a line that professional nurses did not cross, that insubordination charges would follow, that her employment here was measured now in days rather than months. And underneath that clarity, something else, the terrible recognition that she couldn't stop. that even knowing it would cost her everything at Mercy General, she couldn't stand by and watch another person, a child, Captain Caldwell's daughter, become another statistic in the long list of patients missed by physicians too arrogant to see what was right in front of them. The next 2 days dissolved into a kind of quiet hell, the kind where everything looks normal on the monitors but the patient is drowning anyway. Lily's vital signs remain stable on paper, oxygen saturation holding at 96%, heart rate steady at 88 beats per minute, blood pressure a textbook 104/62. The numbers lied. They lied like politicians in election season. Megan watched from the nursing station on the morning of day 3 as Lily picked at her breakfast, the food untouched except for 3 spoonfuls of applesauce. The girl's collarbone had become a sharp ridge, visible even under her hospital gown. Her sternum moved with each breath like the ribs of a small bird trapped in a cage. Captain Caldwell sat in the vinyl chair beside the bed, his uniform trading places with Lily's diminishing frame. She was disappearing, and he was becoming more present, more desperate, his jaw working the way soldiers' jaws work when they're swallowing orders they hate. Dr. Hargrove arrived at rounds like a man reviewing a satisfied patient. He didn't pause. He didn't hesitate. He scanned Lily's chart with the focus of someone checking a box and moved to the next one. Continue current protocol, he said to the resident, a soft-voiced woman named Dr. Chen who flinched at the dismissal. Order another CT scan, repeat the MRI, full metabolic panel again. Sometimes these cases require patience. Sometimes the answer appears on the 7th scan when it missed the first 6. Megan's hand stilled on the keyboard. 7 scans. 20 doctors. The same tests, the same negative results, the same systematic blindness. Doctor, Megan said. Not a question. A statement that wanted to be more. Hargrove's eyes found her across the nursing station the way a predator locates movement in long grass. Nurse O'Brien. Still here, I see. I had hoped your recent counseling session would have encouraged you toward more appropriate duties. Perhaps the medication dispensary. Quiet work. Fewer opportunities to interfere with actual medicine. The words landed the way they were designed to land, public, witnessed by 3 nurses and 2 residents, calculated to remind everyone that Megan had been reprimanded, demoted, diminished. The other nurses pretended to work. One of them, Janet, who'd eaten lunch with Megan 2 weeks ago, suddenly became very interested in the supply order form in her hands. Her heart sounds, Megan said. They're muffled. Noted and documented by 5 cardiologists across 3 facilities, Hargrove replied, turning a page in Lily's chart with the kind of ceremonial slowness that signaled he was done with this conversation. All of whom, I might mention, completed medical school. All of whom reviewed imaging that showed no cardiac pathology. Unless you'd like to contradict them as well. He smiled. It was the smile of someone whose power was so absolute that even insubordination felt like entertainment. Continue the scans. Order an ultrasound of the abdomen. Sometimes malignancy presents this way in pediatric patients. Let's make sure we're not missing a tumor. He said it like a gift. Like he was being thorough. Like he was the kind of doctor who left no stone unturned, who pursued every possibility even after 20 other physicians had walked the same ground and found nothing. He was ordering the exact same tests that had already found nothing. Megan's jaw tightened. She could feel the muscle working at the corner of her face, could feel her molars press against each other hard enough to ache. She'd felt this sensation before, in Ramadi, before the decision to move the convoy route. Before the ambush that killed 2 of her people. The body recognizing danger before the mind had evidence for it. That night, during the evening shift when the ward quieted and the fluorescent lights buzzed their mechanical prayer, Megan sat at the nursing station with Lily's chart spread in front of her like a map of a war she was losing. The other nurses had gone to break. The hall stretched empty except for the soft beeping of monitors, the distant hiss of ventilators in the ICU down the corridor. She traced through Lily's timeline. 84 days ago, 68 pounds, normal appetite, normal energy. Then the decline. Gradual. Systematic. Like someone starving slowly enough that the body couldn't properly signal distress. Weight loss at the rate of 0.2 pounds per day. Respiratory rate climbing by 1 breath per minute every 14 days. Oxygen saturation dropping in quarter-point increments so small that any single measurement looked normal, but the trend was a cliff. The CT scan showed clear lungs. The MRI revealed no masses. The echocardiogram, and here Megan leaned closer, her finger tracing the radiologist's notes, described the heart chambers as normal with adequate ventricular function. But the heart sounds were muffled. And the jugular veins in Lily's neck were beginning to distend. And her liver edge had become palpable. And her respiratory effort was increasing despite supplemental oxygen. That constellation of signs didn't sit in any single scan. It lived in the clinical picture. It whispered from the physical exam. It required someone to know how to listen to the spaces between what the machines reported and what the human body was actually saying. Megan had listened to bodies in combat, in field hospitals where the equipment failed and all you had was your hands and your experience and the terrible clarity that came when someone's life depended on you understanding what your fingertips were telling you. She'd pulled a Navy SEAL from a burning Humvee in Kandahar province and worked a resuscitating thoracotomy with a Leatherman tool, and the only light was from the fire consuming his vehicle. She'd started a surgical airway in a supply tent using a ballpoint pen and a scalpel when a Marine took shrapnel through the larynx. She'd understood, in those moments, that the body was a text that needed to be read not by machines but by people who'd learned the language in the worst possible classrooms. But those qualifications, those experiences, they were locked away in a classified past that didn't exist on her nursing credentials. On paper, she was just a registered nurse with an associate's degree from a community college in Washington state and 11 years of civilian employment history. Nothing more. Nothing special. Certainly not someone who should contradict a physician with an MD and access to a board president's personal cell phone. Megan closed Lily's chart. Opened it again. Ran her finger along the vital signs from the past 48 hours. Heart rate, 84, 86, 88, 89, 91, 92. Climbing. Small increments. Nothing alarming on any single data point. But in combination. Her phone buzzed. Text from Captain Caldwell, can't sleep. Lily's breathing harder. She keeps asking why no one can find what's wrong with her. What do I tell her? Megan stared at the message for 30 seconds. Then she typed, ask her if her chest feels tight. The response came 4 minutes later, yes. She said yes. That word, that clinical confirmation of what Megan's ears had detected and her instincts had screamed, moved something in her chest. Not fear. Fear was a luxury she'd stopped allowing herself years ago. But the recognition that time had become visible. That the slope of Lily's decline wasn't a gentle incline. It was a cliff, and they were approaching the edge, and no one was moving to stop them. Over the next 20 hours, Lily's condition accelerated in a way that the monitoring equipment couldn't quite capture because its programming was designed for dramatic changes, not for the slow orchestration of failure. Her oxygen saturation dropped to 0.5%. Her respiratory rate climbed to 24 breaths per minute. Her skin took on a faint grayish tinge that Megan recognized as the beginning of central cyanosis, the body's oxygen-carrying capacity finally unable to match demand. Dr. Hargrove ordered the ultrasound of the abdomen. It was normal. He ordered another CT scan of the chest with contrast. Normal lungs. Clear mediastinum. No masses. No effusions. No pneumonia. Nothing. Everything was nothing. He stood at the nursing station during afternoon rounds on day 4, reviewing these perfect, useless results with the satisfaction of a man whose diagnostic process was working exactly as designed, tests that found nothing, interpreted as evidence that nothing was wrong. Reassurance, he said to Dr. Chen, is sometimes the best medicine. We can tell this family that we've been extremely thorough. Megan was standing 3 feet away, pretending to review medication orders. She didn't look at him. She'd learned that lesson. But she heard every word, and she understood with a terrible clarity what was about to happen. Hargrove would discharge Lily. He would write in the chart that extensive workup had revealed no pathology, that the weight loss was likely psychosomatic, that the family should consider psychiatric evaluation. Lily would go home, and over the next 5 to 7 days, her breathing would become progressively more labored, her oxygen saturation would drop, her heart would struggle against an increasing load that no scan had detected, and the next time anyone brought her to an emergency room, it would be too late. Megan knew this the way she knew how to recognize an arterial bleed from the angle of blood spray against a wall. The way she knew that the sound a collapsed lung made was distinct from pneumonia. The way her body had learned to read the signs that machines couldn't quantify. But that knowledge lived in a part of her past that wasn't supposed to exist. And she was just a nurse. Just Megan, the quiet one. Just the woman who'd been publicly written up for speaking out of turn. She closed the medication order form and set it down with the kind of deliberate control that meant her hands were not shaking. Her jaw was not clenching. She was not about to do something that would end her career before it had even truly begun. But inside, something that had been dormant for years was beginning to wake. Not fear. Not anger. Something more dangerous, the kind of absolute clarity that came when you'd run out of acceptable options. The code blue alert sounded at 3:17 a.m. Not a page. Not a call. The full system alarm that meant pediatric ward, room 314, and Megan was on the 3rd floor in the medication storage unit when the speakers announced it. She didn't hesitate. Her scrubs were already on, her name badge clipped to her waistband, and muscle memory didn't ask permission, it just moved. Down the back stairwell. 2 flights. 40 seconds. Her boots barely made sound on the tile. Room 314 glowed electric blue under the monitors. Lily lay on the bed with her small ribs heaving, and the heart monitor was screaming a rhythm that shouldn't exist in a child, 180 beats per minute, erratic, the sound of a heart drowning. Her oxygen saturation had plummeted to 74%. The resident on call was at the bedside, hands frozen mid-motion, staring at the rhythm strip like it might suddenly make sense. 2 night shift nurses were running fluids, but their movements had the quality of people who knew the protocol but not the urgency. Megan's presence didn't announce itself with words. She moved past the frozen tableau like water finding its course, and everyone felt the change in air pressure the way you feel a door open in a sealed room. "Captain Caldwell, hold your daughter's hand and don't let go," she said. 3 seconds. Tone like a command that had cleared doors in hospitals across 3 continents. "Someone get me a cart with the ultrasound. Now." The resident finally breathed. "Dr. Hargrove is not here." Megan's hands were already moving, already unwrapping the pericardial ultrasound probe with fingers that knew exactly where to go. She'd done this before. She'd done this when a mortar strike had sent a Navy SEAL's heart into tamponade in a field hospital outside Ramadi while the screaming shook the tent poles. Pain was data. Pressure was poison. And this child was suffocating from inside her own chest. The ultrasound screen illuminated. The pericardial sac bloomed across the display, grossly distended, filled with fluid that glowed grey-white on the ultrasound. 200 cubic centimeters, maybe more. Chyle. Lymphatic fluid leaking from somewhere in the child's mediastinum, collecting around her heart like water in a closed container. Every beat forced her heart deeper into compromise. The fluid had evaded 20 different doctors because it didn't show up on CT scans with enough clarity, and nobody had listened to the clinical signs Megan had been documenting for 2 days: muffled heart sounds, neck vein distension, the subtle dusky quality of a child who couldn't breathe. "Spinal needle," Megan said. 18 gauge. Now. The resident moved, finally moving with purpose because the woman standing at the bedside had the kind of voice that didn't repeat itself. The needle was slapped into Megan's palm, still in its sterile wrapper. She opened it without breaking her concentration, her hands positioning themselves at the 4th intercostal space, just below Lily's left breast, the needle angle already calculated in the part of her brain that had trained for this under fire, in places where you didn't get 3 tries. Captain Caldwell's face was the color of ash. His hand covered his daughter's small hand, and she looked at him with the kind of trust only an 8-year-old can give, the absolute belief that the adults around her would fix this. That trust would have shattered if he'd pulled away. Megan prepped the skin. The needle was cold in her fingers, steady as surgical steel should be, and she found the space between ribs the way she'd found it 20 years ago when her captain had screamed that the insurgent was still moving, still breathing. The needle advanced. The give as it pierced the pericardium was unmistakable, a sensation like puncturing a balloon stretched over water. Milky fluid began to drain. The syringe filled. 40 cc 80. The color was unmistakable to anyone who'd seen chylothorax in combat medicine, the pale cream of lymphatic fluid mixing with blood, the evidence of a system turned against itself. 100 cc. The monitor above them began to shift, the heart rate dropping from that impossible 180, down to 140, then 120, then settling toward 95. Lily gasped. Her eyes fluttered open. 200 cc of fluid stopped draining. The pericardial sac had decompressed enough to let her heart beat freely again, and Captain Caldwell made a sound that came from a place beyond language, not quite a laugh, not quite a sob, the only noise a father can make when his daughter stops dying in front of him. Blood pressure stabilizing, the resident said, and the resident's voice had changed, had become something with wonder in it. Oxygen sac climbing. 78, 82, 88. The door burst inward at 3:27 a.m., 10 minutes after the code had started. Dr. Hargrove. His face was the color of a summer storm. His eyes found Megan at the bedside, found the ultrasound probe still in her hands, found Lily breathing, found the syringe on the tray with 200 cubic centimeters of chyle that no scan had ever shown, that 20 doctors had missed, that one just a nurse had seen and acted on without waiting for permission. The silence in the room lasted exactly 2 seconds. Then Hargrove's jaw clenched, and he turned and left. His footsteps moved down the corridor fast enough that you could hear his shoes striking the tile. 30 seconds later, someone in the hallway could hear him on his cell phone, his voice cutting through the darkness of hospital at night like a scalpel. No, I don't care if it's 3 in the morning. Pick up. This is Dr. Pierce Hargrove calling the hospital board president. We have a critical insubordination issue that requires your attention immediately. One of the nurses performed an unauthorized invasive procedure without physician authorization. The board president's muffled voice came through the receiver, thick with sleep and confusion. A pericardiocentesis, Hargrove said. Without my order. Without any order. Just decided to stick a needle between a child's ribs. I don't care if the child is stable. That's not the point. The point is liability, protocol violation, and the fact that this nurse thinks she can make independent clinical decisions in my department. She needs to be terminated before the hospital gets sued for every penny we have. Megan didn't look away from Lily. The child's breathing had deepened, had become the breathing of a child who was no longer suffocating, and that was the only thing that mattered. The only thing that had ever mattered. Captain Caldwell's hand was still covering his daughter's, and his eyes were locked on Megan's face with an expression that moved somewhere past gratitude toward recognition, the way you look at someone when they've just saved your life and you're seeing them clearly for the first time. Hargrove hung up and didn't come back to room 314. Instead, he went to his office. By 4:13 a.m., he had drafted a formal complaint to the state nursing board, complete with documentation that Megan could produce no evidence of claims of previous unauthorized procedures, pattern of insubordination, creating a hostile environment for physicians. At 5:24 a.m., he made a call to MedReview Associates, a medical consulting firm that happened to be owned by his brother-in-law, and requested an external investigator be sent to Mercy General by 9:06 a.m. that same day. The investigator would arrive with a mandate to review Megan O'Brien's conduct and recommend corrective action. The investigation would be fair and independent, he assured the brother-in-law. Also, could you fast-track this? By noon, security was at Megan's locker. It took for minutes to clear the contents into a cardboard box. A few scrub sets. A photograph of a sunrise over water. A stress ball shaped like a stethoscope. Her badge was deactivated before she was escorted from the building. The parking lot was grey and empty, and she stood in it with that box in her hands like a woman holding the evidence of erasure. Lily had been transferred to the ICU at 4:19 a.m., and the diagnosis was confirmed on imaging: chylothorax with pericardial extension, a rare condition where lymphatic fluid leaks into the chest cavity and eventually into the membrane around the heart. 20 doctors had missed it. One had seen it. And that one was being charged with practicing medicine without a license. But that wasn't the worst part. In the hospital basement, Marcus Webb, the Marine Corps veteran who worked hospital IT and maintained the security footage archives, watched his monitor. He'd seen Megan O'Brien being escorted out, and he recognized something in that moment: the look of a battle-hardened person being discarded by people who didn't understand what they were throwing away. He'd seen it before. He'd been it before. The security footage was automatically backed up to the server, but Hargrove had requested that Marcus delete the footage from the code and the minutes afterward. Delete it, he'd said, because there was ongoing litigation and the footage might be misinterpreted by plaintiff attorneys. Marcus had deleted nothing. Instead, he'd made a copy. High resolution. Time-stamped. Showing exactly what had happened in room 314 from 3:17 a.m. until 3:27 a.m., the moment Megan's hands had positioned that needle, the moment the fluid had drained, the moment Lily's oxygen saturation had climbed back toward normal, the moment Captain Caldwell's face had changed. The footage would surface later. But not today. Today, Megan sat alone in her apartment in the rain, because of course it was raining, because sometimes the universe has a cruel sense of timing, and tried to remember how to breathe without a uniform. Hargrove arrived at the code 10 minutes later, his shoes clicking against the tile with the arrogance of a man accustomed to rooms parting before him. He stopped when he saw Megan standing over Lily's bed, the empty syringe still in her hand, the milky fluid in the collection bag catching the fluorescent light like evidence. The monitor showed what it always should have shown: a steady rhythm. 102 beats per minute. Normal. Stable. Alive. His jaw clenched. Not with relief. With something else entirely. With the particular fury of a man watching his diagnosis collapse in real time. "What did you do?" His voice came out flat, dangerous. Megan didn't turn around. She was already documenting the procedure in Lily's chart, her handwriting precise as surgical stitches. Cardiac tamponade. Pericardiocentesis. 200 cc of chyle. The echocardiography missed it because the effusion doesn't show on imaging, only on clinical examination. Muffled heart sounds, elevated JVD, Beck's triad. You would have seen it if you'd actually examined the patient instead of ordering tests. The words landed like bullets. But Megan's voice carried no accusation, no anger, no triumph. Just fact. Just data. Just the clinical truth that 20 physicians, including the man standing 3 feet away, had somehow collectively missed. Pain is data, and the data was damning. Hargrove's face went the color of old ash. He stood there for approximately 4 seconds, his breathing audible, his hands clenching and unclenching at his sides. Then he turned and walked out of the ICU without another word. Megan finished her documentation. The on-call resident appeared in the doorway, pale and speechless. A nurse she'd never spoken to before came and hugged her, which was strange, which was unwelcome, which Megan endured for exactly 6 seconds before stepping back. Captain Caldwell stood in the corner watching his daughter breathe normally for the first time in 72 hours, and the tears on his face belonged to a man who'd survived Ramadi only to nearly lose his child in a hospital that should have been safe. By 6:56 a.m., while Megan was still in the ICU making sure Lily's vital signs held, Hargrove was in his office making phone calls. The first was to the hospital board president's home, calling before 7 a.m. on a Sunday, the kind of call that wakes you with your heart already racing. Megan didn't know what was said, but the reverberations would echo through Mercy General's corridors within hours. The second call was to the state nursing board. then to a medical consulting firm in Seattle that he had close ties with, though what those ties actually consisted of, Megan would later learn, was a consulting contract worth $40,000 a year, a contract Hargrove apparently feared losing if his judgment came under formal review. He fabricated documentation of unauthorized procedures. He described Megan as a rogue practitioner, a boundary violator, someone who operated outside her scope of practice and put patients at risk. Every word was technically a lie, but lies have a way of sounding convincing when spoken by someone with authority and 3 decades of institutional credibility. He didn't mention that his diagnosis was wrong. He didn't mention that 20 physicians had missed what Megan caught in the dark before dawn. He didn't mention that Lily Caldwell was alive because Megan understood physiology well enough to recognize what a machine couldn't show. By 10 a.m., he'd brought in an external investigator from Portland Medical Consulting Group, a woman named Dr. Patricia Hollis, who arrived at Mercy General with a leather briefcase and the expression of someone attending an autopsy. She spent 2 hours reviewing Megan's personnel file, her training records, her previous evaluations. Everything was perfect. Every evaluation glowed. 15 years at Mercy General with 0 complaints, 0 incidents, 0 flags. That was the problem, actually. Nobody perfect exists. If the file was too clean, there had to be something hidden. By noon, security was at Megan's locker. She saw them coming from the other end of the pediatric corridor, 2 men in navy blue uniforms with radios clipped to their belts, moving with the awkward efficiency of people about to make someone leave. The shift supervisor, Teresa, walked beside them with her eyes down, unable to make eye contact. Megan already knew. She'd seen the pattern. She'd watched Hargrove make calls. She'd heard the whispers that had started spreading through the hospital like smoke through an air vent, unauthorized procedure, scope of practice, investigation pending. The locker they gave her was the one she'd used for 15 years. Same lock, same dent in the corner from when someone dropped a crash cart in 2009. She emptied it methodically. 2 pairs of scrubs. A sweater she rarely wore. A photograph of her in dress uniform from a ceremony she barely remembered attending. A coffee mug that said "World's Okayest Nurse" that someone had given her as a joke. Her badge. Her ID. Everything that said she belonged here. They handed her a manila envelope with termination paperwork already signed by the hospital president. Not even a meeting. Not even the courtesy of explanation. Just, your employment is terminated effective immediately, your badge access is deactivated, security will escort you to your vehicle. One of the guards spoke quietly, "There's no drama, okay? We just walk you out." There was no drama. Megan had trained herself for 20 years not to make drama. She carried the box with her belongings to her car, a 2008 Toyota Corolla that smelled like vinyl and old coffee, and she drove away from Mercy General in the middle of a Tuesday afternoon while overhead the sky turned the color of a bruise. She didn't know, couldn't have known, that Marcus Webb, the IT specialist who'd been quietly monitoring the hospital's security system since Megan's discharge note on Lily's chart lit up his phone at 3:22 a.m., had already made copies of everything. Every second of footage from Lily's room. Every timestamp showing Hargrove's 5-minute visits billed as hour-long consultations. Every frame of Hargrove in the parking lot with a pharmaceutical representative, that envelope of cash passing between them like a secret handshake. Marcus was a former Marine Corps communications specialist, and he understood operational security. He understood evidence. He understood that if Hargrove got away with this, he'd do it again, and the next child wouldn't survive the negligence. Marcus had already walked the external hard drive to the FBI field office that morning. Already handed it to a special agent named Reeves who specialized in healthcare fraud. Already sent an encrypted email listing every patient Hargrove had overbilled in the past for years. But that happened later. That happened after the rain. After Megan sat in her apartment in near darkness, holding a phone that didn't ring, waiting for something, a vindication, an apology, a recognition that she'd been right all along. After she'd applied to the Portland VA and been tentatively accepted as a psychiatric nurse pending background clearance. After she'd finally admitted to someone other than herself that she needed help. 3 days later, an FBI agent arrived at Mercy General with federal warrants. The arrest warrant for Dr. Richard Hargrove was beautifully specific about his crimes: fraudulent billing of phantom procedures, conspiracy with pharmaceutical representatives, falsification of medical records, and the calculated targeting of long-term pediatric patients whose desperate parents wouldn't question endless tests. Hargrove, confident in his initial strategy, assumed they were there about Megan. He was prepared with statements, with documentation of her unauthorized procedure, with his consulting firm's preliminary findings that Megan had violated multiple standards of care. He had his attorney on speed dial. He was ready for war. Instead, he got arithmetic. The FBI agent, a woman named Sarah Kavanaugh with gray eyes and the demeanor of someone who'd spent her career watching privileged men think their way into prison, placed a spreadsheet on his desk. It showed 7 pediatric patients over 4 years. It showed phantom procedures totaling $2,417,000. It showed billing codes for consultations that lasted 5 minutes but were billed as hour-long procedures. It showed Lily Caldwell's case alone, $340,000 in unnecessary testing that served no clinical purpose except to generate invoices. The color drained from Hargrove's face like water from a broken vessel. He demanded they leave. He called his lawyer. Then he made the critical mistake, the one that separated incompetence from desperation. He rushed to the security office and ordered Marcus Webb to delete all footage from the past 3 months. HIPAA compliance, he said. Privacy protection, he insisted. His voice had an edge of panic that Marcus recognized immediately as the sound of a guilty man reaching for a fire extinguisher. Marcus nodded slowly. Already done, sir. Deleted this morning. What Hargrove didn't know was that Marcus had preserved every single frame on an encrypted external hard drive and had personally walked it to the FBI field office at 8 a.m. The footage showed everything. It showed Hargrove's 5-minute consultations. It showed him altering Lily's chart at 11 p.m. on a Sunday night to justify more tests. It showed him in the hospital parking lot handing over a folded envelope to a pharmaceutical representative from a company that made the unnecessary medications he was prescribing. By evening, federal investigators were in the hospital president's office with spreadsheets, with timelines, with the digital detritus of a man who'd convinced himself that his position made him untouchable. The board president, watching his hospital's reputation crater in real time on the evening news, made a single phone call. Not to a lawyer. To the police. Dr. Richard Hargrove was escorted out of Mercy General by the same security guards who'd removed Megan, but this time in handcuffs. His medical license was suspended pending investigation. His attorney negotiated a deal: surrender his license permanently, face no prison time, repay the fraudulently obtained funds. 6 months later, Dr. Richard Hargrove taught CPR certification courses at Portland Community College for $18 an hour, standing in front of high school students and retirees, demonstrating chest compressions on a plastic mannequin, the mannequin's blank face more animated than his own. Meanwhile, Megan stood in Lily's hospital room 2 weeks after Hargrove's arrest, watching an 8-year-old girl who'd dropped from 68 pounds to 51 steadily climb back to 54. 55. The color had returned to her cheeks. The exhaustion had lifted from her eyes. Captain Caldwell handed Megan a package wrapped in brown paper, and when she opened it, she found a pair of combat boots so worn that the leather had cracked along every stress line. Desert sand was still embedded in the creases. Blood, old, dried, the color of rust, was still visible near the sole. I went back to Ramadi last year for a consultation mission, Caldwell said quietly. Found these in a storage container of medical equipment. The name tag was still inside. I thought they were lost forever. Megan held the boot she'd kicked off to run barefoot through fire 20 years ago, running toward a burning Humvee, running toward a Marine she didn't know whose name she'd never learned, the same man who'd walked through the doors of the Portland VA waiting room and whispered, "Senior Chief," into the chaos of his own broken life. Lily looked up from her iPad. Dad says you saved me twice. Once when I was born and once when I was dying. Rachel, Lily's adoptive mother, embraced Megan with the grip of someone who understood exactly what had been taken from her: a sister-in-law dead from infection, an infant nearly lost to negligence and arrogance, and what had been restored. The hospital board reinstated Megan with a formal apology and offered her the position of pediatric clinical director. She negotiated instead for something quieter: 3 days a week at Mercy General, 2 days a week at the Portland VA, working with the veterans whose trauma looked familiar because it belonged to her too. If you've made it this far, you understand something about quiet strength. You understand that the people standing beside you in hospitals and waiting rooms might be carrying invisible medals. Subscribe for more stories about the ones who save us when no one's watching, and comment below, what would you have done in Megan's position?